Okay, and now for tonight's topic. So thank you very much for joining us on this very important occasion to discuss Where Have You Been? Conversations about anxiety and school refusal. Such an important topic. I know in the media it's not uncommon to see phrases like there's an anxiety epidemic. And whether there's an epidemic or not, I think what we as teachers and parents know to be true is that we're seeing an increasing number of students in our classrooms with anxiety. And sometimes we're not seeing them because it's so severe that it's impacting their ability to enter school. And so that's going to be the focus of our conversation tonight. In terms of our format for this evening, I'm going to be in a moment introducing Dr. Ann Unger, who will provide our keynote presentation. And that's going to be followed by a panel discussion. I'll introduce our panelists at the conclusion of Dr. Unger's presentation. And our panelists bring very unique perspectives. We've brought people who have personally experienced anxiety, parents who've had children who've experienced anxiety, and then we have some professionals on our panel too who are going to engage in dialogue. So thanks for joining us. In terms of Dr. Unger, she's a clinical psychologist and an assistant professor in the Department of Medicine in clinical health psychology at the U of M. She's a very proud alumna of the University of Manitoba, having completed her PhD in clinical psychology in 2012. She's really an expert in areas such as cognitive behavior therapy, child-centered therapy, and mindfulness-based approaches. She works in addition with clients of all ages, so children, adolescents, adults, families, and for a wide variety of goals and challenges. And some of those challenges include our topic tonight, anxiety-related disorders, but also depression, trauma, and difficulties with emotion regulation. She also works in private practice as well, so we're very lucky to steal some of her time, at a place called Clinic Psychology in Manitoba, where she provides both therapeutic services, but also consultation and workshops. She is currently the president of the Manitoba Psychological Society, which is the professional association for psychologists here in our province. Dr. Unger, we're so pleased that you could join us tonight because we know in education how important it is to partner with our mental health service providers. We can't do it alone, so we really need you. So thanks very much. So please join me in welcoming Dr. Ann Unger.
All right. Thank you, everyone. It's a pleasure to be here. I have a bit of a daunting task to kind of summarize this topic in a very short period of time. So I apologize for if I talk very quickly. I'm trying to get some things in, and I won't be able to touch on everything. So there may be elements of your experience or things that you think are important that we weren't able to get to today. I'm very grateful to have such a rich panel that is following me so that they can kind of flesh out some of the things that maybe I'm not able to get to in this very short presentation on a very big topic. So school refusal in and of itself is really just the act of children not going to school or refusing to attend. And it's not a diagnostic category of itself because, as you're about to see, there's so many varied and different reasons why children end up not wanting to go to school or do not attend school. And we'll get into some of that a little bit today. So to start, just how big of a problem is this? And as we know, the research that we have on these things are often underestimates when it comes to mental health issues or various problems that people may not be reporting. But we estimate that more than 25% of all youth will engage in some degree of school refusal over the course of their schooling years, ranging from just complaints and threats to avoid school to missing school for some months or even years at a time. And these things, you know, we can work at these things slowly and gradually, and it doesn't necessarily have to become a big problem. But for approximately 1 to 5% of children, again, likely an underestimate, it can become more of a chronic issue. They estimate that the peak age for school refusal is between the ages of 11 and 13, but it happens across the age span and equally affecting boys and girls. So why do kids refuse to go to school? And there are a myriad of reasons. The first one, and the title of the talk today is around anxiety. And anxiety is one of the big causes or one of the contributing factors for children refusing school or other mental health problems actually as well. So it is hard to know the rates of these causes, so how many kids suffer from different of these issues, because often parents are reporting, you know, children just not feeling well, right? And so they're not necessarily saying that, they're feeling anxious. And sometimes it's even hard to know, are they sick or are they feeling anxious at the time? And so we don't necessarily know the rates of these various problems and how they contribute, but we know that they do contribute in a large number of cases. So just very briefly, social anxiety is having anxiety in social situations. One thing I want to highlight about this one is it can be very contained to a specific social situation. So often people will struggle when children, have anxiety for just test taking or just public speaking or with just authority figures, but then they're fine in other situations. And then people may think, well, do they really have social anxiety? And the answer is yes. It doesn't have to be in all situations to qualify for having a social anxiety disorder. So it can be very specific to very generalized. Separation anxiety is one of the more common causes of school refusal, particularly for younger children. And this is a fear associated with being apart from a parent or guardian. Often that something bad is going to happen to the parent, and so they want to be around, and they don't want to have that parent out of their sight for a period of time, and that can be a struggle for them. Generalized anxiety disorder is being overwhelmed by worried thoughts about everyday events, but includes also physical symptoms of anxiety. Specific phobia is where people are afraid of a specific situation or event. OCD, obsessive compulsive disorder, worries take on an obsessive quality or an obsessive nature, and then behaviors are needed to perform to relieve some of that anxiety. Major depressive disorder can be at play for some people. So when children experience consistent low mood associated with symptoms that last over 2 weeks, symptoms of low energy, low motivation, sense of hopelessness, difficulty concentrating, wanting to socially isolate, difficulties with sleep, all of these can contribute to not wanting to attend school or making attending school very difficult. And these are often underdiagnosed in children because, they're quiet, right? They don't stand out necessarily. Oppositional defiant disorder, defiant behaviors at school can create a lot of stress and interpersonal difficulties that can contribute to not wanting to attend. And acute stress disorder and post-traumatic stress disorder are kind of the lasting effects after a traumatic event that can interfere with school attendance in a variety of ways, depending on the symptoms. So for example, children can become very hypervigilant to danger in a school situation. They can experience hopelessness and just not wanting to attend. There may be things at school that remind them of a traumatic event and they want to avoid those. And then adjustment disorder, which is really just marked distress beyond what is usually experienced in response to a stressful situation. So mental health problems can really, there's such a variety of them that can really contribute to children not wanting to attend school. But it's not the only reason. There are other things that can happen or other issues that can be going on that are contributing factors as well. So having a learning disability can affect children wanting to attend school. It can lead to school experiences and the learning experiences being quite negative and quite aversive to them. It can lead to low self-esteem and like a learned helplessness where they just might feel like giving up. Perfectionism, on the opposite end, we have people who have really high expectations, and these can come internally, it can come from other people, and that stress of wanting to achieve can become so great that the children can start to avoid situations such as doing a test, doing homework to the very last minute, and then avoiding altogether. Many environmental influences can play an impact it as well. So low or high expectations from home or school can have some influence. It's usually in combination with other things. Bullying, social rejection, relationship problems at school can have a big impact on children's willingness and wanting to be there and willingness to attend. Sometimes this has to do, there can be discrimination factors, there can be, the children may struggle with social skills themselves and making social situations really problematic. And there is some research to show that the bullying experiences can be so significant for children that they can develop PTSD from some of those experiences. And so it's really important to take that into consideration. And response of adults to these difficulties can make things better, and sometimes they can make things worse. And responses can range from blaming the child to encouraging engagement in school, to enabling avoidance and school refusal. But because the complex factors that are involved in school refusal are sometimes difficult to discern, acknowledging that it's really hard to know how to respond sometimes. It's hard to know what the best answer is, and it's hard to come up with a plan when all of these factors may be at play. And then there's a variety of life stressors or changes that can contribute to school refusal that, just like adults who sometimes need a stress leave from work, sometimes kids feel like they need a stress leave from school, right? Like there's stuff happening at home, or there's stuff happening in their life, or just a change is happening, and it's hard to manage all that change and all that stress and attend school and all the stressors that come with that. So the last statement is really, really important. One of the key ones is there's always a reason why kids don't go to school. We may not know what it is, and it's often more than one reason, all working at the same time. So all those factors I listed, like there's usually multitudes of them all at play for a particular child that's contributing to their not attending school or not wanting to attend school. So for people maybe who haven't known a child who's refused to go to school, here's some examples of what might happen, and you'll probably hear more from the panelists of these. These are just a sampling of things. First of all, there can be complaints of physical symptoms: headache, stomachache, dizziness, chest pain, palpitations, nausea. You can see them all up there. The tricky part is that the anxiety response, the stress response in our body is a physical response. It's not just emotional or cognitive. It has a physiological action on our body, our fight, flight, freeze response. And so this physical symptoms the children are reporting are likely real. So it's not necessarily that they're making up that they're ill and they don't want to go to school. They may feel actually physically ill because of anxiety. And it's tricky sometimes for parents to discern that. So, it makes complete sense that if your child tells you you're sick, they're going to stay home from school, but it becomes a pattern. Then you want to do some more investigating, right? And one of the key ways that can be helpful in discerning is this illness, or is this illness anxiety, is when you remove the anxiety-provoking situation, do the symptoms go away, right? So when the stress and anxiety response comes down, if the physical symptoms clear and they become fine and much more normal again, then it's a clue that anxiety may be what's contributing to those physical symptoms. We hear lots of different statements such as, I want to be with you, or I don't want to be without you, and that may signal some separation issues, just expressing all sorts of fears. They may complain of sleeping problems or have difficulty falling asleep because of the anxiety, crying spells, temper tantrum, can be sadness, it can be anger. Remember, it's a fight, flight, freeze response, so there can be fight in there, right? But it still can be anxiety, right? Even though it can come out as a temper tantrum or anger. Full-on panic attacks, trouble waking up or getting ready for school, and then going to school, but then not going to the class, right? And so often we think, well, you're skipping classes. We treat that as a behavioral problem, and we have to manage that. But maybe there's something else going on there that has more to do maybe with mental health. So what are the implications when children stop attending school? There can be a wide variety of both short and long-term effects. And so this is my pitch for try to address it as soon as possible when you can. Research is showing when school refusal continues over the long term, there can be many compounding implications. One of them is academic. So attendance, obviously, if you're not in the classroom, you can't get the material, it's going to affect your learning. And they've shown that it directly links to graduation rates, and graduation links to employment rates. So it seems small, when they're little kids, you don't think about the long-term impacts, but addressing it really is helpful for their educational and employment success later in life. It can have social implications, so it's difficult to maintain friendships and social skills when you're not having practice and you're not engaging in the same activities your friends are, right? You're missing those shared experiences. And it can have, it may help staying home may help appease the anxiety, other emotional difficulties can result. Children can feel isolated from others. They're missing out on important experiences for their development. Lots of unstructured time and little to do can negatively affect their emotional well-being. They may feel depressed. They may start to feel really bad about themselves. Why can't I? They may judge themselves and blame themselves and feel really bad about their inability to go to school. And so the longer they stay out of school, the harder it is to return, because that anxiety, avoidance actually increases anxiety. I don't know if people know that, but the more you stay away from something, the more fearful that thing becomes in your mind, right? Because you don't have that learned experience that actually it's safe. And so that avoidance can make the anxiety get bigger. If there is a mental health issue that's underlying the school refusal, which can often be the case, sometimes parents say, well, they'll grow out of it. If it's a mental health issue, it's not something that generally will be grown out of. It doesn't necessarily mean that you need, psychotherapy. Many people do, and it can be helpful. There are many things that are therapeutic in our life, but it needs support and treatment. It needs addressing. It's not something that people will necessarily just come out of on their own. And actually, the mental health may worsen without attention. And those negative impacts of school refusal may compound that mental health issue with time. And so it's easier to treat and shift and treat the earlier the issue is identified and addressed. It gets more difficult as things get prolonged. So what's the first step? Well, the first step is figuring out, can we identify some of the factors, which is not an easy task. And it isn't often done in a short period of time. Sometimes it needs a lot of detective work over a long period of time. If school refusal is continuing over the long term, trying to figure out what the underlying cause is, remember there can be so many of the school refusal, because you want the response and the treatment to match the kid, right? The specific factors that influence that child. There isn't going to be a one-stop solution for every child who refuses school, because you saw all those different factors. So you have to really tailor the approach to the child, and it really is going to depend on what the factors are at play for the specific child. So the first thing is really to make sure to rule out medical causes for some of those physical symptoms, right? To have a good check with a pediatrician or doctor, just to make sure we're not missing anything in that realm. And then having some type of assessment, psychological, psychosocial assessment, underlying that, and seeing if you can identify if there is an underlying mental health condition or a learning disability of some kind, or any of those other factors that are going on. This usually involves lots of interviews with the student, with parents, with the teachers, to kind of understand what's the environment around the child, what is the child saying, what are the behaviors that are involved. And it's really important to get the child's perspective as much as possible, to hear their voice. Sometimes they're anxious, they may not want to talk very much, so you gotta warm it up a little bit. And then behavioral observations are also really important component, so that we can understand. Sometimes children can't put into words what they're experiencing, or they can't put into words what's happening for them. And so understanding behavioral observations, how are they engaging in the classroom, or if they're not in the classroom, at home, what kinds of things are happening in terms of contingencies, so what things are being rewarded, what things are experiencing punishment or lack of reward, so that we can kind of identify patterns of behavior and shift things for the child to understand what's going on for them. One example of a tool is the school refusal assessment scale, which kind of gives a questionnaire to look at what are some of the contingencies for a particular child, and part of an assessment package, along with the other things I just talked about. So once, for any particular child, there's I'd love to do a case, but I don't have time, so I'm sorry, that's why I'm not doing one. Once we've identified, what are the factors for a specific child, I'm going to go through a variety of tips. And like I said, you're going to want to pick for the kid the one that works depending on their factors. The one thing that I will say should be in every team, every approach to every child who refuses school is teamwork. So home, school, primary care, mental health team working together. That's what I'd say can be universal for every child, if we can get that. I know I live in ideal land sometimes, but putting together with all those partners a detailed plan that's created and communicated, and regular communication about how the plan is going. And then it's assessment as you go, right? As you do the plan, you may have to reassess, oh, that's not working, we gotta shift that up, it's gotta be a little bit different. But communicating that back and forth and creating and revamping that plan as you go.